Good morning. Ahan Muktada Ningshan Biraba Mampuno Pubu Ikok no Jaduna Kuramjari Ikaikuna Bochari. For this function of the inauguration of Shija Academy of Health Sciences, on the dais, the chief guest of this function, Sir Nongthombam Biren Singh, Chief Minister of Manipur, the guest of honor, T.H. Biswajit Singh Ji, Works Minister, Dr. Palin, CMD, Shija Hospitals, Dr. Amuba, Director and Dean, SAS, Medical Superintendent, SAS, my sister and director, Dr. Boni, and Mrs. Gayatri, and all other invitees, guests, all the staff of not only Shija Hospitals but Shija Academy of Health Sciences, all other dignitaries from government offices, private hospitals, universities, the media brothers and sisters, and everybody here. A very warm good morning to you. Ngasi aigi thausi keynote address haibasida. I was wondering what is keynote address, and to me it meant that I must introduce the organization to the public. So to introduce the organization to the public, I was thinking, what should I say about Shija Hospitals to the public? Is it the structure? Is it how big it is or how small it is or what? But then I thought I must tell something about the character of Shija Hospitals, on the foundation of which Shija survives, lives, and moves forward. So what are the few certain characters which build Shija Hospitals? The first and foremost for us is gratitude, thankfulness, not the word, but the feeling. I feel gratitude, and that is very important for us. So we are very grateful today that the Chief Minister of Manipur, the Works Minister of Manipur has taken out time to inaugurate this function, to inaugurate the academy. Thank you, sir, very much. Yamna thagatsari yamna waijai. Matam kaithopiduna lingbirakpa. We are grateful to everybody here who has come to make this function possible and successful. But not only that, we are grateful for this day to happen. Ngasi haba numitsi oibagi damakta akhoi universe taso akhoi thankfulness uchari. Ngasi habasi akhoi we are seeing the truth of this day. And for this day to happen, there have been many efforts from many sides for which we are grateful. The Chief Minister himself has given essentiality certificate. That is, it is possible to raise a medical college, and there is necessity of a medical college of a private sector in Manipur, the certificate which was given. So we are very thankful to you, sir, for having given that. Also, the dignitaries from Manipur University are also here. We are grateful to them that they have given the permission for affiliation, that there is intent for affiliation, and hopefully very soon the inspection for affiliation has been done, and hopefully affiliation will happen very soon and we'll be moving forward. So we are very grateful for that. We are also grateful to NMC, National Medical Council, which has given us the permission, LOP, letter of permit, to start this medical college here, the first homegrown medical college in the Northeast for the first time. So they have given this permission, and we are very grateful to them. We are also grateful to all the other government departments who have helped in whatever possible way from their side, which is required for the certification of this organization and to make it fruitful. Like land permits, building construction permits, so many other electricity and environment, so many other certificates which are required. So we are very thankful to them as well. I'm also very much thankful that there was RIMS and GENIMS in Manipur earlier. It is because of RIMS and GENIMS that this medical college is possible. Why? Because faculty who were just retired this year from RIMS and GENIMS we are very fortunate that they joined us to become permanent faculty of Shija Academy of Health Sciences, and now you can see them on my right and left side, the entire full strength of Shija faculty, which we are very strongly believe that this is the reason why we are able to do it. And we are very grateful to all the faculty here. Definitely, I cannot miss thanking all the staff who has worked for so many years, 35, 36 years to bring Shija here. But most of all, I must be thankful to the patients and the public of Manipur, Northeast region, and the neighboring Myanmar who have had faith in us and believe in us, believe in this organization, and they come to us for their ailments and their suffering. So we are very thankful to them, and also to all the workers and laborers who have made this possible in a very short time. This application for medical college was done in December of 2020, and by October we were going for certification by NMC, and we got it. So in a very short period of time, we could raise the infrastructure and get it done. So we are very thankful to everybody who has made it possible. The next character of Shija hospitals that makes us here is that we accept the situation as it is, and we also are opportunity seekers. We understood that more than 400 students from Manipur are going out of the state to other countries for medical training. And they are suffering a lot. We practically see how students from China come to us for practical training during their holidays. Second year, third year, medical students in China come to us for training for practical purposes in our hospital. We interact with them and see how difficult it is for them to learn new language and see patients. Not only that, due to Corona, they came back here and now they can't go back for so many reasons. So these are all difficulties which we saw as opportunities for us to develop a medical college which we can help these students and prevent them from going out, so that we can save our state exchequer as well. We know that more than 700 students from Manipur are there in China. So this is a huge opportunity. And we also know that more than 50,000 patients go out of the state every year for treatment outside. So these are not deficiencies, but opportunities where we can bridge the gap and bring the services to this region. So while recognizing the facilities that are required, we developed minimal access surgery, endoscopy, dialysis, and kidney transplant for the first time in this region. And we developed interventional radiology and all other so many departments which excel in their services and fields. So this is what we accept the situation and look for opportunities in them. The next characteristic of Shija which brings us forth is integrity. Today I stand very proud here and say that we have all these so many, my left and right side, all of them full-time faculty members of Shija and Shija family. I seek a big round of applause for them for having faith in this organization to remain as a full-time consultants and doctors here. So this is the integrity that we maintain. There are many more. I'll just try to make it quick now. I wouldn't like to take more time. So humility and humbleness is one thing that we advocate and we practice. So we know that Shija started with a very, very humble beginning as a mono practice. Dr. Palin and Dr. Boni doing an OPD and minor operations in Pauna Bazar, from then shifting to a 9-bed hospital, then increasing to 35-bed, then to 100, and now in Langol Hospital, now to this medical college, stage of medical college. So, beginning from a very humble beginning, all of us, we remain humble and we know that the real value of a human being is that we know we are all human beings, and that is the only real value. Rest are just epithets and attachments of positions, and that is how we try to remain humble. Next is we seek excellence in quality. For that, we have established this NABH pre-entry hospital for the first time here, and we have NABH blood bank, NABL laboratory, which maintains quality and excellence. The infrastructure in the Shija Academy of Health Sciences for the first year is, as by many observers, quite excellent for the first year. So that is how we look forward. And we have looked for excellence and collected Guinness Book of Records for removing the largest neck tumor in a human being. And we also have excellent plastic surgery department doing excellent work where many patients from all over the region are coming for plastic surgery. So just I'm trying to say that we look for excellence in our services. The sixth quality we are grounded with is relationship. We want to keep relationship, cordial relationship with everyone and everywhere. And that is how we look forward. We look a cordial relationship with the universe and the environment. We look for happy relationships with the people of the region, not only the region, but also the neighboring countries like Myanmar. And for that region, we have conducted Mission Myanmar 1, 2, and 3 in the previous few years, where we have conducted 339 free surgeries, which included cleft lip and palate surgeries, laparoscopic surgeries, cataract surgeries, all free in so many missions that we went to Myanmar. And that has developed a very strong relation between the two states, adjoining states of Manipur and Sarang, and not only the states, but also the countries, India and Myanmar. So we look for a very good cordial relationship with everyone. That is our strong point here. Last but not the least, I have many more, but I will end with this very final characteristics of Shija hospitals, that is visualization. Visualization is nothing but conscious dreaming, and we dream. We dream consciously and make it happen. And it is a proof now. You have all seen that we dreamt for a medical college, and it is there for you to see that it is there. Now what do we visualize for the future? We visualize that there will be a university under the Shija banners where all education of different types will be possible. We visualize that with the blessings of the dignitaries, Chief Minister and others, and everybody here, that the campus of Shija will be extended and will make it possible for this university to happen. We also visualize that Manipur will very soon have international flights. And when we visualize these things happen, so we hope that this will also happen very soon. The international border, which was closed for some time, we visualize that it is open, and through that we'll be able to serve patients not only from Myanmar but beyond Thailand, Laos, and further Southeast Asian countries. We also visualize that we will be able to put our services in the border in Moreh, so that we may be able to serve more people from the neighboring countries and make Manipur a global healthcare destination in this region and bring medical tourism to the best possible tourism in health in the region. Let me end by saying this proverb, this Chinese proverb. It says, if you are planning for 1 year, sow rice. Chahi amagi khalagadi phau oina lingbiu haibneba. If you are planning for a decade, plant trees. Chahi taragi khalagadi o oina thabiu haibneba. Aduga, if you are thinking for a lifetime and the future, educate people. So that is exactly what we are trying to do, and that is what we are looking forward to. Thank you for your patient listening. Thank you very much for everyone. Thank you. Khoram Jari.